Alrighty, so I'm going to talk about hernias in dogs. And there's 5 different kinds. There's umbilical, inguinal, diaphragmatic, perennial, and hiatal. So umbilical is the most common type, and you'll normally find it in like puppies and stuff, but you can tell pretty obviously that it's squishy and it has a bulge pretty much where your belly button would be, except in dogs.
And then if you palpated this, what would you feel?
You'd feel the intestine itself. So yeah, it'll be a protrusion on the belly button area of the dog.
And it looks like it's probably always mid-ventral.
Yeah.
Right?
Most of the time, yeah. Next is the inguinal, and it's found in the groin area towards the inner folds, like kind of where your leg comes up on the dog. And as you can tell, this dog's got a pretty severe hernia. And these, you can have them vary in size, and then it's usually left untreated. If left untreated, the intestine can die off and peritonitis can set in, which in case that can happen in any of the larger hernias. And next is the diaphragmatic, and it's basically when the diaphragm muscle is torn, as you can see in this image here, and the intestine is slipped up and it can push on the lungs, causing hard times to breathe and troubles with the heart. And then in this x-ray you can see, so normally your lung, it'd have more of this D shape, and it should just be more of a straight line kind of area. But you can see the intestines kind of came in from, they probably did a barium series, is what I would guess, and they've taken x-rays of the dog as the bariums move through and it's pushed up into the lung area.
Yeah, before you go on,
Yeah.
if you've ever either done or observed surgery on the abdominal cavity, it is incredible how the intestines are moving. And so I can envision a hole, and what they'll do, the intestine, it doesn't like just fall through, it works its way through. It's going to actively work its way through the hole.
Exactly.
That's how you can
That's
get
why
that
this dog had so much,
Yeah.
And it probably has this much in the lung area, I would say, because most of the time when these are discovered, it's from a dog being hit by a car. So it's caused that damage there, but you don't do an x-ray, or at least my clinic, we don't do an x-ray at least till the next day. So this dog had been setting at least for a day from when it got hit.
So they wait at least a day, so
For
if there's a
trauma.
hole, then the
Yeah.
intestine will have worked through, is that what you're saying?
That's what I would figure there,
Okay.
why there's so much
Okay.
in this.
Yeah.
I mean,
I got
I've
you.
never seen one
Okay.
personally in the clinic of this kind of hernia.
Yeah, that's dramatic.
Yeah. I'm not sure with it being like this image being that large if they would do mesh. Some veterinarians have used mesh that I found out because I was talking with one of the vets I knew, and she said most of the time they'll just use suture.
So you're saying on the diaphragm, suture it up?
Yeah, you're
Rather
just
than-
using suture
Okay,
to sew
okay.
up that area. Mainly because mesh has ran into a lot of infections that'll happen in the dog after it's been placed inside of it.
Okay.
And then you'd have to do surgery, cut it back open, go back in, remove it, if that was the case. So the next one is the perennial hernia. And basically it's found right by the anus, and it's those muscles that tore. And it causes, as you can see kind of here, this was one of the better ones I could find, where it kind of just pushes out the intestines, but sometimes it happens mainly in the male, not neutered, or not yet, male dogs that haven't been neutered yet. And the next one is hiatal. So this one I kind of didn't completely understand when I was reading through it, but it's a piece of the stomach that is pushed into the diaphragm, where you can see here they did another barium series, and it's pushing up into the diaphragm of the dog. Usually caused by some sort of trauma, so probably hit by a car or something like that. And you can see there's another image here where this is your normal stomach to esophagus, and then it's been actually pushed up, so instead of having this little bulge here, some of that's been pushed into the esophagus itself. course, it could, you know, these would be life-threatening if not caught in the right amount of time. I didn't see on how they would fix something like this, or if it is fixable.
Yeah, I don't know, maybe they push it back and then maybe, because it's really, there's gonna be a hole through the
Right.
diaphragm for the esophagus to come in, so maybe they push it back and then tighten it up a little bit, I don't know.
Possibly.
But you can see where that could run into trouble if they tighten it up too much, then you wouldn't get food passage.
I wonder if they tighten it and tack it to the diaphragm so it can't,
Yeah.
like, the top.
So that happen again.
So it won't push
Oh,
up.
yeah. I bet
That
you
would be
do.
the one, yeah.
Yeah.
If they were gonna. do
Maybe that's,
something like
maybe
that.
instead of closing the hole off, they just bring that down and then tack it to the diaphragm like you're saying, and then it wouldn't slip,
Yeah.
but you
Yeah.
wouldn't have to
So
worry
you have to
about.
have a little hole,
Right,
Oh, yeah,
like in this
yeah.
image here.
Yeah,
yeah.
but see, remember the esophagus is bringing food down under muscle contraction, so it's not like free flowing, it's
Right.
being pushed through there, so. Yeah, that'd be interesting.
Yeah.
Okay,
And then that's it.
questions, here we go.
Yeah.
So like for the umbilical and the perennial hernias,
Yeah.
so is there like a connective tissue that like constricts and that just allows the intestines to sit there and it just kind of constricts and just holds it there? Or is it an actual like rib in the abdominal wall? Like
It's an
this?
actual rib.
Okay.
It's a hole that you could put your fingers through.
Yeah.
To help those hernias, you can push your finger up into the
Yeah.
body cavity.
So like this little dog, you could actually push, I'd say at least 1 to 2 fingers
Yeah,
to
probably.
push the intestines back in. I've seen another bulldog, over the summer, she had 3 hernia surgeries. Because, well, what would happen, she'd go home, then come back a couple of days later and they go, oh, it tore open again. Well, they didn't let her sit in a cage or anything, they let her go running, and
Okay.
she was one that would jump up on your leg too. So
Yeah.
they didn't let the 7 to 10 days, and then the 3rd time we go, we're gonna keep her for 10 days and that's it.
Did you really?
Yeah, we kept her in the kennels for 10 days and she hasn't came back yet.
Mhm.
But yeah, her 3rd time was like, plus, you know, when the doctors were going in, because I was on the 3rd surgery, there was a lot of scar tissue
Yeah.
that had to go through.
Every time you
So,
go back,
yeah.
you're gonna have scar tissue, so that was probably.
Exactly.
That's,
So if it's caused by rips, then what happens in the umbilical hernia? What rips?
well,
It'd be
where the umbilical cord went to the placenta,
Right.
there's a
Oh.
passageway, and that's where that's at. That's why they're called umbilical.
Kind of like for humans, you know, you got your innies and outies,
Mhm.
which could be a small hernia itself, but usually you want to get those treated because they're
Right.
too small.
Right. Yeah, but those are good pictures, and then,
Yeah.
of course, it happens in all animals. How many have seen it in pigs? Big time, yeah. Can really,
Yeah.
if you're not handling the animals all the time, sometimes they're gonna go really bad fast.
That's
And you
true.
can lose the animal.
Yeah.
Okay, well, thank you.